Assalamualaikum warahmatullahi wabarakatuh. I'm Siti Widya Nazhrah from Occupational Health and Safety Department, Faculty of Public Health, Universitas Indonesia, and also the second author is Professor Fatma Lestari from Occupational Health and Safety Department, Faculty of Public Health, Universitas Indonesia, and also Head of Disaster Risk Reduction Center, Universitas Indonesia. In this time, I would like to share the COVID-19 in the workplace, a case study in agriculture industry. So, the agenda today is background to share strategies and challenges facing COVID-19 in the workplace, conclusion, and also recommendation. So, this is the background. Since the first case in Indonesia was announced on 2nd March 2020, the Indonesian government has tried to suppress the spread of coronavirus disease, as we know, COVID-19 infection in workers by issuing regulations related to the prevention and control of COVID-19 in the workplace. The regulations are Health Ministry decree regarding guidelines for the prevention and control of COVID-19 in the office and industrial workplace in supporting business continuity in a pandemic situation. And the second regulation is Manpower Minister Circular Letter regarding business continuity plan in facing the COVID-19 pandemic and the COVID-19 transmission prevention protocol in the company. Indonesia's palm oil industry remains a main pillar of the country of economic resilience in time on the ongoing pandemic situation. Speaking in the International Palm Oil Conference, the coordinating minister for maritime affairs and investment said that the country's palm oil industry is a main contributor in earning foreign exchange and support the Indonesian economy, especially in times of the COVID-19 pandemic. Despite of this pandemic, the palm oil industry was one that remained quite stable and was not significantly affected. However, palm oil industry is one of the labor-intensive industry. It makes that this industry has a high probability of spreading COVID-19. The variables in this research are rapid tests, drivers in control, health surveillance, impacts on organization, tracking and tracing system, regulation, barriers in control, work productivity, and the data collection from company, document review, interview, focus group discussion, and analyzed with thematic and content analysis. The second section is the strategies and challenges facing COVID-19 in the workplace. As a company in agriculture sector, palm oil industry, it has a business continuity plan. The business continuity plan covers recognizing, identification of pandemic risk, planning for risk mitigation, identification of pandemic's impact response, designing and implementing business continuity plans, communicating business continuity plans, conducting business continuity planning tests. This industry runs in two different places, head office in Jakarta and site or remote area in several provinces in Sumatra, Kalimantan, Sulawesi, Papua. And the company has a policy to prevent COVID-19. The policy covering all employees, both head office and remote area to ensure business continuity and risk management. The first policy working arrangement like work from home or work from office, cubicle partition between employees, conducted disinfectant regularly, sterilized rooms, and changing air conditioning filter. Provide IT facilities to maximize the usage of online communication, business travel arrangements, suspend non-urgent business trips, COVID-19 handling mechanism, deadline for working from home, that every employee must maintain work productivity at the time of work from home implementation. And also the company makes policies adjusted to a current condition and government regulation, for example, when PPKM. Okay, the following is an illustration of the implementation. The company has business continuity plan, COVID task force, 3M, 3T, work from home, rapid testing for all, PCR testing targeted, temperature checks, self-risk assessment, company doctor and clinic, internal communication, education, employee monitoring and enforcement, and management of returning travelers. For example, for contact tracing, it has a policy that employee check-in by scanning the QR codes on arrival at the office, when moving one floor to another, and before entering every location or every room with QR code. The daily check-in, the employee must fill in ID number and body temperature. The challenges facing COVID-19 in the workplace are difficulties to increase workers' awareness and change the behavior due to limited resources, inability to control the use of public transport, interaction with family members and personal trips, and limited access to health services, internet network, and technologies in some remote areas. The last section, conclusion and recommendation. The conclusion, this industry is one of the critical industries. Therefore, companies must balancing the interest of supporting the state, like consumption needs and export, complying with regulation and health protocols. The health protocols was identified well established in large organizations. The recommendations are the multi-agency approach. Pentahelix must be improved to integrate efforts to improve health protocols that are in line with company productivity, especially during the pandemics. The government must be more assertive in dealing with COVID-19 through regulation. The regulation, the policies, and a supervision of the policies. And workplace should have a comprehensive and documented health surveillance programs. That's all that I can present. Acknowledgement, we would like to express my special thanks to Haskalinus Pasang and Romi Mariansa for their support in completing this project. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.